Answer questions 59 to 63 on the basis of the following information. Your patient is a 29-year-old female complaining of the sudden onset of severe shortness of breath and chest pain. She indicates that she is recovering from surgery to her left femur after an automobile crash.
61. This patient's physiological problems are most likely due to what cardiac problem? A. The right side of the heart pumping against increased resistance. B. The left side of the heart pumping against decreased resistance. C. The right side of the heart pumping against decreased resistance. D. The left side of the heart pumping against increased resistance. Answer: A. Rationale: the pulmonary embolism has caused the right side of the heart to have to pump harder against a resistance caused by the partial blockage. This results in the severe shortness of breath and hypoxia. 62. Proper management of this patient includes which of the following? A. 4 fluid boluses. B. Low flow oxygen. C. Ventilatory assistance. D. Transport in shock position.
Answer: D.
Rationale: this patient should be transported in the position in which it is easiest for her to breathe, i.e., the shock position. 63. Which of the following conditions is a common cause of this patient's problem? A. Placement of a central line. B. Ruptured cerebral aneurysm. C. Myocardial tissue damage. D. Taking anticoagulant drugs. Answer: A. Rationale: myocardial infarction, ruptured aneurysm, and anticoagulant use are not common causes of pulmonary embolism. 64. Which of the following combinations are the only two situations in which a pre-hospital provider should place a gloved hand into the vagina? A. Shoulder dystocia and prolapsed cord. B. Prolapsed cord and breech presentation. C. Placental abruption and breech presentation. D. Breech presentation and postpartum hemorrhage.
Answer: B.
Rationale: in both of these cases, relieving pressure off the trapped umbilical cord, prolapsed, or the face and airway passages, trapped breech, may be the life-saving measure provided by the paramedic. 65. A patient suspected of showing early signs of shock should usually be placed supine with his or her feet elevated. When is this position contraindicated? A. When a head injury is suspected. B. If shock is due to hypovolemia. C. If you suspect respiratory alkalosis. D. If respirations are inadequate.
Answer: A.
Rationale: the shock position is used only if head injury is not suspected. 66. Which statement about deflation of the PSG/mast in the field setting is correct? A. Deflation should be accomplished rapidly in the field. B. Deflate the legs first, and then the abdominal compartment. C. Deflate the garment if the patient begins to experience dyspnea. D. Deflation should not be attempted in the field without medical direction.
Answer: D.
Rationale: because the PSG corrects a symptom and not the underlying problem, deflation should be attempted only in the hospital after the underlying hypovolemia is corrected. 67. Which of the following statements is true regarding a single limb presentation during an emergency delivery? A. Grasp the presenting part of the baby and gently rotate it so the baby will deliver. B. This is a non-deliverable presentation and requires immediate transport to an appropriate receiving facility. C. Assist the mother in delivering the baby by applying gentle traction to the limb. D. Apply firm pressure to the presenting part to delay birth until the patient is transferred to the emergency department staff.
Answer: B.
Rationale: a limb presentation during delivery requires a cesarean section to complete the delivery. Provide high-flow oxygen and care to the mother during transport. 68. When responding to the scene of a hazardous materials incident, the EMS crew should approach from A. Downhill and downwind. B. Downhill and upwind. C. Uphill and downwind. D. Uphill and upwind.
Answer: D.
Rationale: the rule of thumb when approaching a hazardous materials situation can be remembered as being up, and away. This will help minimize risk exposure to the crew. 69. How should you position a patient with a suspected CVA and no other pertinent history? A. Supine with the head raised 15 degrees. B. In the left lateral recumbent position. C. Supine with the feet raised 15 degrees. D. In the right lateral recumbent position.
Answer: A.
Rationale: the patient should be supine with the head elevated to enhance venous return. If congestive heart failure is present, the patient should be positioned at least semi-Fowlers, sitting up at least 45 degrees. 70. The vital signs of a patient experiencing the later stages of increased intracranial pressure will be characterized by which of the following? A. Increased blood pressure, decreased pulse and respiratory rate. B. Increased blood pressure, pulse and respiratory rate. C. Decreased blood pressure, increased pulse and respiratory rate. D. Decreased blood pressure, pulse and respiratory rate.
Answer: A.
Rationale: these changes, increased blood pressure, decreased pulse and respiratory rate, are characteristic of patients with increased intracranial pressure. 71. The T-wave on an ECG tracing represents which of the following events? A. Repolarization of the ventricles. B. Depolarization of the atria. C. Depolarization of the ventricles. D. Repolarization of the atria.
Answer: A.
Rationale: the T-wave on the ECG reflects the repolarization of the ventricles. 72. You are analyzing a patient's heart rate on an ECG strip. You note that there are 13 complexes within one 6-second interval. You would record the heart rate as which of the following? A. 6. B. 13. C. 78. D. 130.
Answer: D.
Rationale: calculate the rate by multiplying the number of complexes in a 6-second interval by 10. The heart rate is 130. 73. Normal atrial depolarization is seen on the lead 2 ECG strip as which of the following waveforms? A. A negative rounded P wave. B. A positive rounded P wave. C. A flattened P wave. D. A biphasic P wave.
Answer: B.
Rationale: normal atrial depolarization is represented in lead 2 as a positive rounded P wave. 74. Which of the following is an abnormal finding on an ECG strip? A. A PR interval of 0.16 seconds. B. A PR interval of 0.10 seconds. C. A QRS complex of 0.10 seconds. D. A QRS complex of 0.08 seconds.
Answer: B.
Rationale: a normal PR interval is 0.12 to 0.20 seconds. A normal QRS complex lasts 0.04 to 0.12 seconds. 75. An EMS crew attempts to resuscitate a 50-year-old male in cardiac arrest and is not successful. The family sues the EMS organization for negligence. The crew will need to prove that its actions during the resuscitation A. Were extraordinary and heroic. B. Were not within their duty to act. C. Exceeded the standards set forth by the American Heart Association. D. Were similar to the actions a reasonably prudent person would do under similar circumstances.
Answer: D.
Rationale: the reasonable person standard sets a minimum guideline for what similarly trained personnel would do under similar circumstances, in this case, a cardiac arrest. As long as the crew could demonstrate that its actions were reasonable and expected to be done by other pre-hospital care providers in a similar situation, this would avoid a negligence allegation. 76. How does the Valsalva maneuver improve a too rapid heartbeat? A. It forces the patient to slow down his or her respirations. B. It stimulates the vagus nerve to slow the heart rate. C. It inhibits the release of acetylcholine, slowing the heart. D. It stimulates the carotid artery, slowing blood return.
Answer: B.
Rationale: the Valsalva maneuver, bearing down against a closed glottis, stimulates the vagus nerve, which innervates the heart. 77. Which dysrhythmia may be a sign of digitalis toxicity? A. Atrial fibrillation with a ventricular rate of less than 60. B. Premature junctional contractions leading to tachycardia. C. Acute onset paroxysmal supraventricular tachycardia. D. Atrial flutter with a ventricular rate greater than 120.
Answer: A.
Rationale: atrial fibrillation with a low ventricular rate is suggestive of digitalis toxicity. 78. Your patient is a 67-year-old man who has a pulse and whose ECG strip shows ventricular tachycardia. What should you do after administering oxygen and placing in 4-line? A. Administer 6 milligrams of adenosine via rapid 4-push. B. Administer 2.5 to 5.0 milligrams of verapamil via 4. C. Sedate and perform synchronized cardioversion. D. Administer 1.0 to 1.5 mg/kg lidocaine via 4. 78. Your patient is a 67-year-old man who has a pulse and whose ECG strip shows ventricular tachycardia. What should you do after administering oxygen and placing in 4-line? A. Administer 6 milligrams of adenosine via rapid 4-push. B. Administer 2.5 to 5.0 milligrams of verapamil via 4. C. Sedate and perform synchronized cardioversion. D. Administer 1.0 to 1.5 mg/kg lidocaine via 4.
Answer D.
Rationale: lidocaine is the first-choice drug for perfusing ventricular tachycardia. 79. Which of the following is a risk factor for the formation of atherosclerosis? A. Alcoholism. B. Excessive exercise. C. Diabetes mellitus. D. Cancer.
Answer C.
Rationale: risk factors for atherosclerosis include diabetes, advanced age, obesity, lack of exercise, hypertension, and smoking. 40. The pain caused by myocardial infarction is usually relieved only by the use of which of the following medications? A. Nitroglycerin. B. Acetaminophen. C. Oxygen. D. Morphine.
Answer D.
Rationale: the pain of myocardial infarction is not relieved by nitroglycerin, acetaminophen, or oxygen. Morphine is usually needed.